This is a recording for the MedSurg 1 musculoskeletal exam. There will be 60 questions for this. Patient diagnosed with gouty arthritis. Accumulation of uric acid crystals. Gouty arthritis is accumulation of uric acid crystals. Acute attack gout. Which care or plan should not be included? For gout should be fluid restriction. Priority nursing intervention. Impending embolism is to administer airway or oxygen in the respiratory emergency. Number four, clinical sign of gouty arthritis. You'll have toffee deposits. Gouty arthritis, toffee deposits. Mr. Cruz says rheumatoid arthritis. Ask if there's a cure. Most appropriate response would be no. There's no cure, but there are drugs that are being developed to better control the disease. So say no, but there's drugs that are developed to better control the disease. Patient has multiple soft tissue injuries from motorbike accident. Answer would be elevation and put ice to control edema. Elevation and put ice to control edema. Bone fracture in forearm or tibia. Complain sharp, deep, and relenting pain on hand and foot. Indicates which complication. That will be compartment syndrome. The answer is compartment syndrome. The total hip replacement surgery. And before surgery, nurse conducts preoperative teaching session. Nurse can tell teaching session is effective when the patient verbalizes the importance of avoiding which of the following actions. Letter C and D, internal rotating the feet and bending to pick up items from the floor. So rotating the feet and bending. Nurse prepares teaching plan for a patient with total above the knee amputation, left leg. After amputation, an exercise will be begin the day after. Exercise should begin the day after. Patient has fiberglass cast on the right arm. Which should nurse include in the plan of care? Assessing the movement of the fingers and tingling. Assessing the movement of the fingers and tingling. Appropriate diagnosis for patient with sprained ankle. Impaired physical mobility. So talking about impaired physical mobility for sprained ankle. Patient with osteoporosis. In this metabolic disorder, rate of bone reabsorption accelerates while bone formation slows. It's called postmenopausal. Postmenopausal. When caring for a patient with acute gout attack, nurse administering which medication? Colchicine. Colchicine. Fractured tibia. Teaching how to walk with crutches. Which is appropriate? Pull. Put all the weight on your hands. Put all the weight on your hands. 15. Nurse observes thoracic curve of humpback. So thoracic kyphosis. Thoracic kyphosis. Woman with family history of osteoporosis has postmenopausal syndrome. Asks nurse how much calcium she should consume daily. Is 1,000 to 1,500. 1,000 to 1,500 milligram calcium. Which diagnostic exam used to find abnormalities of the brain? So brain MRI. Patient is 89, has a right elbow knee amputation, progressing well, but continues to complain of pain in right foot. He is suffering from phantom pain. With a more appropriate response. Amputated continues to send messages to the brain. So phantom pain is amputated, continues to send messages to the brain. Suffered intrafracture left hip. Inserted prosthetic instructed to turn every 2 hours. Nursing intervention is to keep legs abducted so they don't become dislocated. Answer is abducted so they don't become dislocated. Compartment syndrome fracture and ulna, nursing assessment signs and symptoms of what? Volkmann's contraction. Volkmann's contraction. Patient fell 2 days ago, has compound fracture to his left tibia. Physician performed open reduction with internal fixation. Important nursing assessment would include elevated temperature and presence of erythema on incision site. Elevated temperature and presence of erythema on incision site. A patient age 24 is recovering a fracture from tibia being seen at the clinic for follow-up. Patient was asking what is the callus formation. The nurse should reply. It is part of bone healing process at the fracture site. New bone develops over the fracture site. So it is part of the bone healing process at the fracture site and new bone develops over the fracture site. 45-year-old patient subjective data include burning pain or tingling in hand. Burning pain or tingling in hand. So 24-year-old patient left foot amputated from motorcycle accident is receiving morphine and complains of burning sensation in his left foot. Nurse complains that explains that this is a phantom pain and its cause is not really understood. This is a phantom pain and its cause is not really understood. Patient age 28 has fracture in fibula. Nurses is assessing the purpose of capillary refill or performing blanching actions called arterial peripheral circulation. Arterial peripheral circulation. Patient receiving prophylactic drug. Rationale for heparin is to decrease the risk for thrombosis formation. Decrease the risk for thrombosis formation. RA patient, the nurse should remember told the patient what during teaching. Rest and exercise are both important parts of therapy. So you better tell them have rest and exercise for the RA patient. 71-year-old is manifesting signs and symptoms of gout. Nurse should pay attention to what? Edema and discoloration of great toe. Edema and discoloration of great toe is about gout. So 20-year-old suffer compound fractured femur. Nurse should expect physician to order what? It's a tetanus. Tetanus intramuscular. A patient has undergone a bipolar repair or arthroplasty. She should be instructed to what? Avoid crossing legs. Don't cross legs. 64-year-old has osteoarthritis in left hip. Nurse should encourage the use of IS. Encourage the use of IS. A 28-year-old male has left fracture humerus, has fractured the left humerus, has cast in his arm. The nurse observes pallor, paleness. Observation indicate compartment syndrome. It's called compartment syndrome. When caring for a patient who has shock, the nurse should provide oxygen to support respiratory function. Provide oxygen to support respiratory action. Nurse noticed abnormal curvature in the lumbar area of a 28-year-old female. Lumbar lordosis. Lumbar lordosis. The answer is lordosis. Patient is treated in physician's office after fall with sprained ankle. Before going home, the nurse teaches patient to avoid this item for 24 hours. Application of heating pad, so don't put heating pad in there. Patient returning home, patient shows understanding instruction after arthroscopy. There's a report fever or signs of inflammation. Report fever or signs of inflammation. Nurse attending the program, which should be considered the highest priority. Allergies, allergies to iodine. Patient never had chest X-ray. Nurse should tell patient to follow the procedure is too necessary to remove the jewelries. Remove those jewelries. Patient receives treatment. Legs are not even. The other leg is shorter. The patient might have what? Fracture. Shorter leg might be an indication of fracture. Patient may be having fracture and a fall injury. What should you do? Immobilize the leg before moving the patient. Immobilize the leg before moving the patient. So patient has fiberglass cast applied on the leg. Patient will be able to bear weight on the cast within 20 to 30 minutes after application. It's 20 to 30 minutes after application. Patient with hip fracture. What should the nurse include in the care plan? To provide comfort and reduce muscle spasm, provide fracture mobilization. So comfort, muscle spasm, and provide fracture immobilization. Skin traction is over bed frame, and patient is not allowed to turn, which is actually to provide good skin care. So there's no injury there in the skin. Ask the patient to pull on the trapeze. Ask the patient to pull on the trapeze. Cerebrovascular accident has partial hemiplegia on left leg. The straight leg cane is not quite sufficient any longer, so you can benefit. Forearm, quad cane. Quad cane. Nurse eval patient pain, left side weakness. Nurse would intervene when nurse observe patient move cane when right leg is moved. Move the cane when the right leg is moved. Okay, nurse caring for patient with fresh application leg cast. Prevent development of compartment syndrome by elevating a limb and applying ice to the affected site. So, elevating a limb and applying ice to the affected site. Patient complaining of low back pain, radiating down to the left posterior thigh. Nurse continues to collect data if there's bending and lifting. Bending and lifting. True or false for every for the next five questions. Glue